Greetings for the day. I am Kirti Mendu, and today I would like to brief you on study about healthcare online policies to see how the industry manages the privacy issues. Before that, I would like to give a small introduction on how important are the privacy policies for any organization. Since here we are focusing on healthcare, I would like to talk more about it. Policy in healthcare is vital important as it sets a general plan of action used to guide the desired outcome and is a fundamental guideline to help make decisions. The purpose of the healthcare policy and procedures is to communicate to employees that the desired outcome of the organization. Here we are considering the Cleveland in our research. So considering the Cleveland Clinic stated in their information policies or privacy policies that they collect the usernames and passwords, personal health information like diagnosis and other doctor reviews, amongst other. These show how healthcare companies embrace the transparency in online privacy. Privacy within the organization is at risk considering workers can access their different data although they may not be authorized to do so. The explanatory research method aligns with the qualitative research revealed vital insight that led to the results of the discussion. Coming to the literature review, both professionals and patients changed to technology's resources for health services, and these presented a threat when there is an information asymmetry for the data accessed online and offline. Providing healthcare services online, such as considering the Mayo Clinic here, admit to collect the Internet protocols, that is the IP addresses, for those who access their websites. Some of the ethical issues facing healthcare policies online and their privacies are confidentiality, security breaches, and system implementation. Industry that follows a bottom-up approach centered on technology providing insufficient regarding solving the privacy and security issues. Healthcare online policies need to advance their prospects to cater to the new opportunities of collecting data like Internet of Things that also present. Some organizations stated that research efforts should focus on social mechanisms that influence privacy preservation behaviors. The public tends to share confidentiality and vital information through online channels, hence the need to protect them from harm. Noticeably, the healthcare companies differ in their exercise of power, and this impacts the privacy management. In the research methods, the explanatory research method will be applied. The explanatory research methodology will get applied to understand different concepts that influence the topic. I will use qualitative element here to explain the concepts like privacy policy and the involved ethics. I'm using or the topic of discussion is data collection methods. The data collection methods is the open-ended questionnaire that will get administrated to relevant person. The participants in this regard include professionals like healthcare workers that engage with the technology, uh, and the data analyst, the managers, information governance, etc. The data collection will seek comprehensive information that will get analyzed according to the explanatory research method. Coming to the result after implementing the explanatory methodology for research, the respondents stated that it is common for data to sit in within the organizations. Few responders opinion that it is unethical for someone in, let's say, finance department trying to access the confidential data related to a patient's cancer treatment progress. One of the questionnaire responses stated that They need to adhere the guidelines set by the organization such as the World Health Organization affect the healthcare operations. In the discussion, I would like to talk about the increased implementation of technology in healthcare matters that come at the expenses of the privacy policies of that organization. Concerning healthcare, failures to ensure optimum privacy destroys an organization's reputation, limit their chances to access connection, among other issues. There is a sufficient knowledge of privacy among healthcare professionals, but how to implement this is a challenge. With the minimal care, the other workers can access information that they are not authorized to because they work in the same environment. The trait of openness allowed hospitals like Mayo Clinic and Cleveland Clinic to reveal what information they collect. The transparency enabled clients to get information on the clinic to extend of the privacy and how it gets assured and be. In conclusion, online healthcare policies appreciate privacy concerns and they embrace transparency on what data is collected and how it is used while leveraging on technologies like encrypting for mobile communication to promote the privacy. Noticeably, the industries made significant strides in managing the privacy issues where technology, big data, and humanistic efforts are incorporated. These are the following references that I have used to gather the information regarding the topic. Please do leave a comment for questions if any. Thank you.